All right, receiving treatment in the comfort of your own home. Up next, we're going to be talking about the benefits of home health care and the important discussions you should be having right now with your loved ones. Well, this is a tough but very important topic. Having a sick or dying family member or loved one, really at any age, can be really hard. But being at home instead of going to a group home or doctor's office or hospital can bring them a lot of comfort. So that's where nonprofits like Home Assist Health can be really beneficial to provide in-home health care. So joining us to talk about this very important topic, and it's a conversation that we all will probably have at some point in our lives, is Sara Wilson, CEO of Home Assist Health. So Sara, good morning. Thank you.
Good morning. Thanks for having me.
Yeah, that's a tough conversation, isn't it? And you really need to have it in advance of something happening, I'm guessing.
Yes, and for a long time, it's been a taboo conversation to have about how do I want to live in my final years or as a result of a health impact, illness, an accident. But having those conversations as early as 18 can kind of set your action plan forward. What is most important to me? Where do I want to receive my care? Who do I want to help make decisions for me if the event occurs where I can't speak for myself? And I think COVID really actually opened the doors to having these conversations earlier than people were before. So it's a perfect timing to start with this new year.
Yeah, how do you start that conversation? By saying, what would you like?
There's this thing called a joy list, and it kind of helps to reframe what has typically been seen as a difficult conversation. And it's asking questions like, what brings you most joy? Where are you happiest? What are your medical preferences? And where do you want to receive that medical care?
And nothing against going to a home, but I'm guessing most people want to be in their own home and have maybe people come to them?
Yes. In fact, we have somebody that we care for, and she's 87, and she bought her home at 17 years old.
Oh, really?
And her personal wish has been to remain at home until her final day. And so her family, including her grandchildren, have been part of making that wish possible. So we also encourage and ask people to involve your children. People need to know that this is a normal part of planning and discussing and being prepared before the critical event happens.
Yeah, when my father passed, he did it in his own bed, in his own home, and I always thought that's how I would want to go for sure. So you have some tips that you can offer people?
I would encourage, there's a great resource online called 5 Wishes, and you can put together your wishes, your plans into that document, share it with family, your medical providers, update it at key milestones, whether it's a birthday, an annual event, but share that frequently, update it frequently, include all important family members. And I think if you do that, you feel a greater sense of control and comfort for when that moment does happen.
So when you're making that decision on what the person wants, I'm sure the financial part of it comes into play. So, you know, you have to make that decision as well.
The earlier you plan, the more you can be prepared. So if you know you want to have some long-term care benefits, then you start discussing earlier, and then you can go for long-term care insurance early enough to afford that type of care you prefer when the time comes.
Do you have a website or something where people can just get general information?
They can visit Home Assist Health. We'd be glad to counsel them or give them advice on what they can do and what their options are.
All right, Sara, thank you so much.
Thank you.
We appreciate you coming in to talk about that.